She's gonna perform for Chris, that's why.
Is that why? Yeah, look, we got close.
Girl. Yeah. Good job, buddy.
Dr. Calvert, have a seat right there, or next to my clipboard there where I was sitting.
Girl.
Hi.
Keep your leash loose. You're doing great.
Good
Keep your
job,
leash loose.
Lily.
Just a reminder, you didn't do anything wrong.
Okay. Look at you.
Good job. Hi.
Good girl,
Oh,
Lily.
good. Good.
Look, get it.
Well, you did really good in that you came around in like an arc, like the dog's like she's very attuned to the straight line approaches.
Okay.
And but it's pressure when you come in over the top of her like this. So sitting for the quicker you sit, the better she'll like you, because movement triggers them too and brings arousal up really high. So for just to have a good
No
opening
begging.
to sit down quick and
Look at, hey, that's a big improvement.
tail's still tucked.
Better.
And don't reach out, make her come in for the treat, put it, and then once she starts to see, oh, there's trust here. Like you're not reaching for me initially, you're not bending over me initially, that will help. Usually once I get I do this when I'm meeting a new dog and I'm mindful of my pressures, then the dog says, oh, okay, you get me, and then they allow the pressures.
Yeah.
But their eyesight's not that great, of course. But sometimes they know through scent. But I think it's just an association with you since you're the primary caregiver.
Yeah.
You were really good with your leash pressure.
Okay.
So I don't know if it's but that's something to think about in the exam room if you're popping
When
her.
she shakes like that, what does that mean?
That's her coming down in arousal.
Okay.
It's her relaxing a little bit. It's like I was tense and now I'm not.
I'm like, okay, I know the shaking means something I
Because
can't
you
remember
don't
what it was.
see that, like, that's not at
But-
home, you don't notice the shaking.
Well, sometimes like people come in, and we're doing the whole ordeal,
Uh-huh.
and then she shakes, and I'm like, that means something.
Yeah, she does. Lip licks is her anxiety going up. Shake is her coming down. So whenever you see the shake, I would come up with a word like good settle or good calm. And so when you see the hard mouth, go to the soft mouth, or you see the calm sort just kind of relaxes, or you can even see the open mouth and you see the tongue. That's a great relaxation. If you see automatic sits when she's in the presence of the doctor, all those things are things where I would say, oh, good settle. But stretch out your words, keep it low arousal and comforting. You're doing really good in that you're not like a lot of people want to comfort a lot with petting, and one pet or a touchstone is great. Like, I'm here for you. But if you do too much, it stimulates them tactily and will bring arousal up, and it feeds the anxiety. Like, that's the one thing we can control is the arousal level.
Her tail's better, but still she comes to you.
So try the targeting stick. So you ever done a targeting stick? So this is what we use in the zoos to keep the animals focused on. It's like grounding, like psychiatrists use some sort of grounding, like when people have trauma, they have them go into the area and they think about 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell. And so it buys you time when you're in the belly of the beast, in the area where that triggers you, like an airplane or something like that. So it's called grounding. So what we can do with a target stick is, I've seen this in like at Center County Paws, we started using target sticks and we trained it away. Now she's already focused on the stick. Don't ever move it towards her. Move it side to side, perpendicular to her, or just tap the stool or something with it and tell her touch. And bring it about nose height.
Did something come, like, off of that? Look at that. Oh, hi. Good girl.
It has a built-in clicker, so if you hold it perpendicularly, put the treats behind you and out of the way, and make her earn them through touch. Then she has to,
Is she supposed to touch it with her nose?
yeah, any part of it, but eventually just the focal point. Now, to help her, Jane, reach over and do the 2 fingers and tell her to touch.
Touch.
Yes,
Good girl.
and then feed.
Yes, and should she feed or should
You
I
should
feed?
feed.
Okay, let's do it again.
Because we want to get her used to
Touch.
the doctor more. So the targeting stick, you could use it while she's examining, But the target stick gives her something to focus on rather than, oh, is this lady gonna put a thermometer at my butt? So it kind of calms them down. And what we did with really barrier aggressive dogs over at the shelter, we trained this away from the kennel.
That's it.
And then what we did is we brought it out to the kennel once they knew what it was. The targeting stick is better than the hand because it's a physical thing that they connect.
Good girl.
You can use a fly swatter, you could use a spoon, a wooden spoon, anything. And I like wooden spoons because it can hold scent if you like a scent that she likes that's calming. Then you're incorporating sight, touch, and smell. And with a click, hearing. So that's for the grounding senses. And it helps the dog kind of focus on that. So in the zoo, what we do is, like we'll take a baseball or something, put it in with a tiger, and they just want to keep touching it because each time they touch it, we say yes and throw in a piece of meat. Meanwhile, they're working on the tail and getting blood out of it, getting a blood draw out of it. So that's what we do. And I could send you both a sheet I've done, but look at good and feed for that. So she made that one happen. You weren't paying attention to her. She's like, okay, I know what's paying in this moment. I'm gonna touch this thing, and boom, she just made the doctor give her a treat. She's so food motivated. That's a great thing with her. Yeah, she's really food motivated.